couple of years ago, when I was an intermediate user, I would say I was introduced to the Atlas stent back at the University of Lübeck with Peter Schramm. And I didn't have that much experience back then. And to me, that open cell stent I was using extensively was a game changer in terms of suddenly I could treat any aneurysm, how matter complex it is. And so this similar philosophy, I guess, is with the PEGASUS stent. PEGASUS provides the same ease of deploying it into also very difficult anatomy. You can reach it with with a small catheter. I usually use an SL10 or Echelon to reach any place I want, and there's no anatomy change. So any hairpin loop of vessels, you place it. There's no anatomy change at all. It's easy to deploy, and primarily probably overseeing over 40 cases now with aneurysm treatments. Most of them actually are bifurcation aneurysms in that case, and most of them are I use the stent in a Y configuration. There's not one single case where it was difficult to reach the aneurysm through the struts, even in a tangent way. When you have sidewall aneurysms with the stent covering it, you can, at least so far, I hadn't had any problems reaching the aneurysm and just coil it. And laser cut open cell stent is, to me, the ideal device to pretty much treat any aneurysm you want. There's no limitation. So what we've seen in the flow diverters P48 and P64 is that we widen our spectrum of patients we can treat. All the anticoagulated patients, we can do single antiplatelet therapy without problems. We have enough cases to be certain with that, even to do it. And with the PEGASUS stent, even more so, I think, because the material is much less, you have much more material in the vessel, you probably can be even more less conservative starting a single antiplatelet therapy if you need to. And the current practice, at least at our side, is that most of them are elective aneurysms. We do dual antiplatelet therapy, but for a very short time. We do 2 months follow-up, and if everything looks fine, we just change to single antiplatelet therapy. And we don't have any single ischemic events, and I'm always seeing over 40 cases, and that gives us the confidence so far to go on with that regimen. Well, that's the aneurysm side, and maybe more importantly, I guess the new hype that's coming up, or the need that's coming up, is maybe getting into a new trial that shows evidence that primary stenting of intracranial arterial disease, stenosis, is beneficial. And I think with these new types of stents, with coating, HPC coating, I would think it's prime time to show that probably you don't have to wait for 2 strokes and infarcts to treat the patients, but maybe you can do it earlier in really high stenotic patients. And I think the PEGASUS may show a benefit, at least from our anecdotal cases. It's very encouraging what we see.